NCLEX RN answers 2026 questions to check your understanding instantly. Question 1. Immediately following surgery for an open reduction internal fixation of a fractured hip, the nurse should give priority to assessing. Option A, serum collection, Davol, drain. Option B, client's pain. Option C, nutritional status. Option D, immobilizer. The correct answer is option A, serum collection, Davol, drain. Monitoring for excessive drainage or hemorrhage from the surgical site is the immediate postoperative priority. Question 2. Which statement by a family member indicates an understanding of the nurse's teaching regarding a percutaneous gastrostomy tube? Option A. I must flush the tube with water after feedings and clamp the tube. Option B. I must check placement 4 times per day. Option C. I will report to the doctor any signs of indigestion. Option D. If my father is unable to swallow, I will discontinue the feeding. The correct answer is option A. I must flush the tube with water after feedings and clamp the tube. Flushing the tube after feeding prevents clogging, and clamping the tube prevents the backflow of gastric contents. Question 3. A client is 2 hours post-total knee replacement. Which information requires notification of the doctor? Option A. A bleeding on the dressing is 3 centimeters in diameter. Option B. The client has a temperature of 100.6 degrees Fahrenheit 38.1 degrees Celsius. Option C. The client's hematocrit is 26%. Option D. The urinary output has been 60 during the last 2 hours. The correct answer is option C. The client's hematocrit is 26%. A hematocrit of 26% is significantly low, suggesting substantial blood loss during or after surgery that may require a transfusion. Question 4. The nurse is caring for a client with a 5-year-old diagnosis of plumbism. Which history is most likely related? Option A. The client has traveled out of the country in the last 6 months. Option B. The client's parents are skilled stained glass artists. Option C. The client lives in a house built in the 1970s. Option D. The client has several brothers and sisters. The correct answer is option B. The client's parents are skilled stained glass artists. Lead, plumbism, is used in the soldering process of stained glass. If parents are artists, the child may have been exposed to lead dust or fumes. Question 5. Which equipment would assist the client with a total hip replacement with activities of daily living? Option A. High-seat commode. Option B. Recliner. Option C. TENS unit. Option D. Abduction pillow. The correct answer is option A. High-seat commode. A high-seat commode prevents the hip from flexing more than 90 degrees, which is a critical precaution to prevent prosthesis dislocation. Question 6. In anticipation of complications from anesthesia and narcotics in an elderly surgical client, the nurse should: Option A. Administer oxygen via nasal cannula. Option B. Have Narcan, naloxone, available. Option C. Prepare to administer blood products. Option D. Prepare to do cardio resuscitation. The correct answer is option B. Have Narcan, naloxone, available. Elderly patients are at higher risk for respiratory depression from narcotics. Naloxone, Narcan, should be readily available as an antidote. Question 7. A client with a history of abusing barbiturates abruptly stops taking the medication. The nurse should give priority to assessing the client for: Option A. Depression and suicidal ideation. Option B. Tachycardia and diarrhea. Option C. Muscle cramping and abdominal pain. Option D. Tachycardia and euphoric mood. The correct answer is option C. Muscle cramping and abdominal pain. Withdrawal from barbiturates is life-threatening and characterized by severe physical symptoms including muscle spasms, tremors, and abdominal pain. Question 8. During the assessment of a laboring client, the nurse notes that the FHT are loudest in the upper right quadrant. The infant is most likely in which position? Option A. Right breech presentation. Option B. Right occiput anterior presentation. Option C. Left sacral anterior presentation. Option D. Left occiput transverse presentation. The correct answer is option A. Right breech presentation. Fetal heart tones heard in the upper quadrants of the abdomen usually indicate a breech presentation.